Hello, my name is Connie Strassheim. I'm a healthcare researcher and writer and the author of 4 books on holistic healing, the latest of which is entitled Defeat Cancer, 15 Doctors of Integrative and Naturopathic Medicine Tell You How. I wrote this book because I believe that better solutions for cancer treatment were needed besides what is found in conventional medicine. And I believe that those solutions were out there and that I could find them if I just researched. Now, my thinking along these lines is the result of my own battle with chronic illness. I suffered from chronic Lyme disease for over 10 years, and I was disabled by it for nearly 7 years. And it took me several years to get adequate treatment, and I had to spend a lot of time researching to find a Lyme literate doctor, that is, a doctor who is competent in treating late-stage chronic Lyme disease. And as a result of my journey, I published a book called Insights into Lyme Disease Treatment, and for this book I interviewed 13 doctors who were competent in treating late-stage Lyme disease, and that book has been a huge success and I believe has shortened the treatment runway for a lot of people. But the doctors that I interviewed in this book, they treat chronic Lyme disease with methods that aren't typically used in conventional medicine, and I believed that their methods were more effective for me, and that the same scenario was true for cancer, that there were doctors outside of conventional medicine who were doing great work in treating patients with terminal and late-stage cancers and who were having better success than conventional medicine was having. So I in fact found this to be true and ended up interviewing 15 medical doctors, osteopaths, and naturopaths who treat cancer either as a major part of their practice or exclusively. And these doctors use integrative medicine, which combines the best of allopathic or conventional medicine with naturopathy and other medical disciplines. Basically, it takes the best of the medicine that's found in different medical disciplines. And so anyway, for this book, what I did is I interviewed each doctor, the interviews were anywhere from an hour and a half to 3 hours long. I transcribed the interviews, then rewrote them so that they would read like a book instead of a conversation, because I believe that it's much easier for readers to read a book that's not, rather than an interview that's full of a lot of unnecessary words. But it's also challenging to write books this way because you have to be really careful not to alter the doctor's information. So what I did after I finished each doctor's chapter was I allowed the doctors to edit their chapters, and we basically ping-ponged the drafts back and forth until the doctors were completely satisfied with the information that we were providing in the book. So anyway, each chapter in this book is dedicated to the particular treatment protocol of a specific doctor in the book, and there are different sections in the book. And the first section, of course, is devoted to anti-neoplastic or anti-cancer treatments, including strategies that address different survival pathways that cancer uses, such as angiogenesis, which is new tumor blood vessel formation, and tumors create these blood vessels to get their nutrition. So the book contains treatments that address all of the cancer's survival mechanisms, basically. And some of the treatments that are described include insulin potentiation therapy, which makes use of the hormone insulin to make low-dose chemotherapy more effective. And basically with IPT, you can use chemotherapy at only 1/10 of the dose and get better results than if you had given the patient full-dose chemotherapy. Some of the other treatments include mistletoe, which has been widely used in Europe for many years, dendritic cell vaccines, intravenous vitamin C, anti-neoplastins, pancreatic enzymes, hyperthermia, sono and photodynamic therapy, which is a treatment that's been perfected by a doctor in England, and just so on. There's also a section on supportive treatments such as intravenous nutrients and immune boosting substances. There's a section on hormones and how hormones affect cancer and how you treat cancers that are influenced by hormones. There's a section on dietary recommendations, which comprises an integral part of cancer treatment, lifestyle recommendations for healing, challenges to healing, factors that affect healing, emotional strategies for healing, and the role of emotions in cancer development. And And also there's a section on how family and friends can help their loved ones with cancer. And finally, the doctors share the treatment outcomes that they have with their patients. So as I mentioned, the book was a formidable challenge, but I believe it's resulted in an excellent product. And I realize that there are already a lot of cancer books out there. There are a lot of alternative treatment options that are described on the internet and in other cancer books. And what I believe makes this book unique is that, and one of its advantages is that the information comes from doctors who have successfully treated a lot of late-stage and terminal cancer patients, so they know what works and what doesn't work and what works for a majority. And so that's one of the advantages. The other is that readers can also compare treatments that different doctors are using, and by comparing the treatments come up with a consensus as to what they think is going to be the best treatment, or what are the best treatments for them based on all of the collective evidence. And of course the answer on what works for people is going to be different for everybody because we all have a different biochemistry, but there are certain treatments which have been proven over and over again to work for large numbers of people, and those treatments are described in this book. And when those treatments are used by doctors who are skilled in tailoring treatments to the individual, and when they're combined in a protocol that also addresses the immune system and healing the rest of the body, they can be very, very effective. So for more information on this book, I invite you to go to the book's website, which is cancerbooksource.com. And on that website, there's a free sample chapter. There's a lot of information about the doctors and just about the book itself. So I believe it's going to be a great work that just helps thousands of people to live longer lives with cancer, so with or without cancer. So thank you so much, and I look forward to getting your feedback.